You're on.
Okay, welcome. So I'm going to talk to you a little bit about insertion of tympanostomy tubes. And so tympanostomy tubes are placed in the ears for a variety of reasons that could include recurring ear infections or for patients who have fluid behind the eardrum that is persistent and may be associated with hearing loss or structural changes that are concerning for potentially long-term damage to the eardrum or the ossicles, which are little bones of hearing. Putting tubes in the ears is usually a simple procedure, and in adults is often done right in the office. In kids, because we can't guarantee they will sit still, often it is done in the hospital under a very short exposure of a gas anesthetic, and they'll breathe through a little mask and fall asleep for just a few minutes. And during the procedure, I am looking at the eardrum with a microscope, and I make a very small incision in the eardrum. I then suction out any fluid that's behind the eardrum and then place a very small tube into that slit. And the idea is to keep a hole open from the ear canal through the eardrum to the space behind the eardrum. So normal ear function requires that our eustachian tubes do a good job, and that's our own ventilating system. So everyone will realize they have a eustachian tube if they've ever been in an airplane or driven up and down a steep hill in your car. You can have pressure changes in your ears and feel the need to plug your nose and try to pop your ear. So if you've ever done that, you've blown air up through your eustachian tube. Normally the eustachian tube is closed, but it should open intermittently when we yawn or swallow. And the reason we get into problems with kids having recurring ear infections or fluid that just won't drain on its own is because their own eustachian tube just, for whatever reason, is not ready to do the job that it's supposed to do. So when we place a tube in the eardrum, we're basically bypassing the natural drainage system. And at that point, it doesn't matter if the normal eustachian tube is not doing its job, because now we've got an extra route for air to get in and any fluid to come out. So normally, those tubes will last on average about 1.5 years. The eardrum will shed skin, and it'll usually shed the tube with it, and how quickly that process happens determines how quickly the tube comes out. There are some rare situations where fluid will actually push the tube out earlier than we would expect, or there are cases where the tube will stay in longer. So on average, though, it's 1.5 years, and we'll have patients follow us intermittently until we know the tube is out and to confirm that the eardrum has completely healed. Some of the risks for that surgery include having a tube that does not come out, and if it's persistent, beyond 2.5 to 3 years, sometimes I will recommend removing it and patching the hole, and that's because there's a greater chance that the tube won't come out or that we'll be left with a permanent hole when it does. Another risk is that the tube, when it comes out, that there will be a hole in the eardrum that does not heal. If that happens, then I usually will wait until kids are closer to the age of 8 before considering patching that hole, because we don't want to patch it and then have the same problem reoccur where we have to put another hole in the eardrum for a tube. So most kids have outgrown the problem by the age of 8. So I hope this gives you some information to help in understanding why we do the procedure and some of the information about the procedure. Of note, about 5-6 years ago, I'm not sure, maybe 2013, 2014, something like that, the rules changed for how we care for kids who've had tubes in their ears. Prior to that, it was very common to restrict water exposure and to recommend earplugs and headbands to keep water out of the ear canals. And what was discovered, that is, if you took 100 kids who had tubes in their ears and let all of them have fun and play in the water as if they did not have tubes in the ears, only 4 out of the 100 ever have any problems with their ears. So the rules have changed, and now there is a recommendation to just really go about life as normal, as if there were no tubes in the ears. And then if your child is experiencing ear pain or drainage, after getting water in the ears, then maybe they're one of those 4 out of 100 who have problems, and then we start recommending restricting exposure and putting plugs and things like that. It is recommended to avoid having your kids, be swimming and putting their head under the water in dirty water, regardless. So, again, hopefully this is good information to help you understand, what tubes are all about, and I look forward to seeing you in the near future.